There's growing concerns about the dangerous coronavirus from China. The number of cases has gone from a few dozen last week to nearly 300 now, and health officials have confirmed that the virus can spread from person to person. Gio Benitez is at JFK Airport here in New York, where they're now screening passengers from China. Good morning, Gio.
Hey, George, good morning. Yeah, the World Health Organization is holding an emergency meeting tomorrow to talk about this virus as more and more people get sick in Asia. And now we're learning this morning that the number of deaths is also growing. This morning, a major development as U.S. officials work to learn more about the mysterious new coronavirus and keep it out of the country. Now we're learning of new cases indicating that the virus has the potential to spread from human to human, proving that it does not only spread from animals to humans. At least 14 healthcare workers in China have now contracted the virus after treating infected patients. At least 6 people have died, and the number of confirmed cases has quadrupled to nearly 300. And it's not just China. Take a look. Since the virus first appeared in the central Chinese city of Wuhan last month, it has spread into neighboring countries like Japan, Thailand, and South Korea. Back in the States, the CDC screening thousands of passengers arriving from Wuhan at JFK, LAX, and SFO. Officials checking temperatures, looking for symptoms similar to the common cold, flu, or even pneumonia as travelers enter the country. At this train station in Hong Kong, passengers getting screened for the virus right off the train. Our Bob Woodruff speaking to one American tourist at the station who decided to cut his visit short.
Is it kind of frightening at all to you that this is starting to spread?
Oh yes, of course, that's why I'm going home.
And this morning we're seeing reports from The Sun in the UK saying that a British tourist in Thailand, just 32 years old, may be the first Westerner affected by this virus. He's battling pneumonia-like conditions in the hospital right now. But again, we should tell you that so far here in America, there are no known cases. Michael.
All right, thank you so much, Gio. Our chief medical correspondent, Dr. Jen Aston, joined us now. And Jen, some big new developments.
Yeah.
Human-to-human transmission.
Yeah.
How concerning is that?
It's concerning, Michael, because we have to remember coronavirus normally exists in animals. As recently as just yesterday, there was a suspicion that it could spread animal to human, a suspicion it could spread human to human. Now that's confirmed. And obviously for most people, it's easier to avoid contact with animals than it is to avoid contact with other humans.
And then what about the fact that 14 medical workers, they've been sick as well?
Yeah, you know, that's also significant. According to Chinese reports, all 14 medical workers were taking care of one patient. And what that really brings up is the possibility of this phenomenon known as a super spreader. We saw it in SARS. That's one person who can literally infect hundreds or thousands of people. And again, a lot of this is being informed by the experience with SARS, which so far is causing some concern.
So how worried should people be here in the U.S.?
Listen, we have to emphasize this is a dynamic and evolving situation. U.S. public health officials are still saying that the risk to the U.S. population is low, but we have to be clear. We don't yet know how this virus spreads. We know it can be passed human to human, but we don't know how, and we don't know how